Hello, everybody. Thank you for attending the Emergency Infection Prevention meeting. My name is Kyle Mataya, infection preventionist. I'd like to share my screen. And today we're going to talk about hand, foot, and mouth disease. I was notified by San Diego Public Health that there is a health alert out for increased cases in enterovirus infection. You can see on the right here. That's kind of what it looks like. The infectious agent is hand, foot, and mouth disease, not to be confused with foot and mouth disease, which affects cattle, only cattle, but it's caused by Coxsackie virus or enterovirus. And these are non-enveloped single-stranded RNA viruses. So if you think about the double helix in DNA, imagine just one part of the helix, a single strand, and it's just floating around. There's no capsule or envelope around it. Most common is mouth or throat pain symptom, and this is called the ananthem. Vesicles are surrounded by a halo of erythema, just redness, usually 2 to 6 millimeters, not itchy, and usually not painful, and they last about 10 days. It could be on the hands, feet, buttocks, legs, or arms, but rare cases can involve neurological disease. Some risk factors are children less than 5 years old are most likely to develop serious complications, but people at risk to get the disease, period, are those who are just exposed to others with the disease. So contaminated fluids. So if they're touching the blisters, with their hands, or they're coughing and there's blisters in the mouth, right? Or they're sharing things, in the household. So if they're sharing towels or, I don't know, a toothbrush or touching the same door handle or sleeping in the same bed or sharing equipment like bathrooms, or even nurses that are going from one patient to the next. If the nurse is not doing good hand hygiene, they can spread it that way. Diagnostics, we can test the stool, we can do light microscopy, we can monitor levels of antibody in the blood, but the most common is PCR to identify the genes with hand, foot, and mouth disease. So PCR is basically taking a double-stranded piece of DNA or RNA. We split them apart and we rebuild those pieces together. And we do another split apart and rebuild those pieces. So you can see that over time, we're getting a lot of duplication of these genes. And so we can test for these genes. Transmission prevention, so CDC in Appendix A states that standard precautions is okay. So whenever you're going to touch body fluids, you should just wear gloves and use hand sanitizer after. But if they're incontinent, then we should use contact precautions, basically gloves and wear a gown when we're changing that patient, with hand sanitizer before and after too. Prevention, we can clean and disinfect things that are in the patient's environment or used on the patient. Good hand hygiene, good respiratory etiquette, right? We're not coughing all over the place. We're going to wear a mask. Dedicate items for the patient so they have their own blood vital signs machine, avoid close contact, and isolate from work or school. Treatment is just usually 7 to 10 days. We're just going to supportive treatment and watch for persistent fever, neurological symptoms, or secondary infection. So I hope you learned a little bit about hand, foot, and mouth disease, and hopefully we can prevent the spread. Thank you.